Hello friends. Hello friends, let us now learn some important points about cell injury. Now, in the cell injury, first we will learn about the causes of cell injury. What is pathology? Pathology is the science of disease. So, first we will learn about the causes of cell injury. So, there are many causes of cell injury which include most common cause of cell injury is hypoxia. So, most common cause of cell injury is hypoxia, that is decreased oxygen. This hypoxia can be due to ischemia. Ischemia is in fact the most common cause of hypoxia. It can be due to anemia or cardiorespiratory disease. Then the next cause of cell injury is physical factors. Physical factors like radiation exposure, burns, pressure are the physical factors responsible for cell injury. Then we also have some chemical factors responsible for cell injury like the drugs, poisons and chemicals can also cause death of the cells. Infections like bacteria, viruses can lead to cell death. Immunological reactions like any autoimmune disorders like SLE, Sjogren syndrome can also cause cell death. Genetic causes and nutritional causes results in cell injury. So, first we will learn what is the mechanism of hypoxia causing cell injury. Hypoxia will induce a transcription factor called as hypoxia inducible factor 1. So, with the help of this hypoxia inducible factor 1, it causes blood vessel formation, it activates cell survival pathways and it increases anaerobic glycolysis. So this is the pathway of hypoxia. So now let us learn about the types of hypoxia. There are 4 different types of hypoxia. So in the types of hypoxia, we have 4 different types of hypoxia. One, hypoxic hypoxia, anemic hypoxia, histotoxic hypoxia, and finally we have stagnant hypoxia. So first, hypoxic hypoxia. Hypoxic hypoxia occurs in high altitude chronic obstructive pulmonary disease, interstitial lung disease and right to left shunts. All these will result in hypoxic hypoxia because the oxygen is not reaching the blood. So in second type, that is in anemic hypoxia, the problem is anemia, that is there is decreased functional hemoglobin due to anemia, or it can also be due to altered hemoglobin which cannot be used for oxygen transport like carboxyhemoglobin in carbon monoxide poisoning or methemoglobin, that is in methemoglobin ferrous gets converted to ferric during oxidation which gets converted to methemoglobin. This iron combines with hemoglobin to form methemoglobin. This methemoglobin is associated with newborns. It is seen in newborns who are exposed to nitrates, sulfonamides and local anesthetics. This methemoglobin is also associated with cytochrome B5 reductase deficiency. So normally ferrous undergoes oxidation to form ferric form. This ferric form gets converted to ferrous form back to ferrous form, that is ferrous form is regenerated by cytochrome B5 reductase. If this cytochrome B5 reductase is deficient, then the ferric form is not converted back to ferrous form which will result in methemoglobin. The third type of hypoxia, if you see etiology, is due to cyanide poisoning. cyanide will inhibit cytochrome. So this cyanide, because it inhibits cytochrome, this is important for generation of ATP through electron transport chain. Cytochrome is an enzyme in electron transport chain. So there is no ATP, so it is toxic to the cells. So this is also associated with IV nitroprusside usage long term. Treatment of cyanide poisoning or histotoxic hypoxia is amyl nitrate or sodium thiosulfate. Amyl nitrate and sodium thiosulfate are used for histotoxic hypoxia. Whereas for anemic hypoxia, we can use IV methylene blue can be used. Then the last type is stagnant hypoxia, where it occurs most commonly due to ischemia and congestion. So these are the different types of hypoxia. So now let us learn about, because of hypoxia there has been cell injury. Think of that. If there is cell injury, now based on the severity of cell injury can be based on nature of cell or duration of injury. So if you see the nature of cells, neurons are the most sensitive cells to cell injury, followed by cardiac fibers, where a cardiac fiber dies within 20 minutes, followed by skeletal muscle fiber, and the most resistant to cell injury is fibroblast. Even in the CNS or in any of the above organs, there are some susceptible areas of ischemia. In CNS, Purkinje cells of cerebellum, cerebral cortical neurons in 3, 5, 6 layers are most susceptible areas to ischemia. In cardiac region, subendocardial area is also most susceptible to ischemia. In GIT, splenic flexure is most susceptible to ischemia. So these are the different areas where they are more susceptible to ischemia. Then if you see once there is cell injury, what happens? Cell injury can lead to either adaptation, where cell undergoes changes in order to survive, or it can cause injury, causing reversible injury or irreversible injury. Thank you guys for watching my lecture. In the next class, we will learn about reversible cell injury. Thank you.